weakened immune systems who are still vulnerable and face many challenges as the country reopens. Kristy Dickinson, founder and CEO of Chronically Simple, joins us with what the general public needs to know in order to keep this vulnerable population safe. Good morning. Thanks for joining us.
Good morning. Thank you for having me.
Now, you're among them. You actually have a EDS. Tell us what it is, and you're immunocompromised, correct?
I am, yes. I have Ehlers-Danlos syndrome and ankylosing spondylitis. So Ehlers-Danlos syndrome is a rare connective tissue disorder, and ankylosing spondylitis is arthritis in your spine. So both of those together, well, singly would be an issue, but together with the medications that I take, I'm on immunosuppressant drugs to help treat those conditions, which do leave me immunocompromised.
And there are many immunocompromised Canadians. We don't know who they are. You can't tell. But it should be noted with vaccines, quite the percentage of immunocompromised Canadians, they're not producing antibodies, so particularly vulnerable. Vaccines aren't helping them.
Yes, it's a concern because we call that invisible illness, and we know that there are over 1 million Canadians that are immunocompromised, but there might not be a visual cue. So, if you saw me walking down the street, you wouldn't know that my immune system doesn't work properly, and so therefore I am particularly vulnerable to this virus, especially with the efficacy of the vaccines not being what we had hoped. We really still have to remain quite vigilant in our protective measures that we've been using throughout the last 18, 19 months.
And that's something the general public needs to think about when we're out and about.
Yeah, I know everybody is feeling pandemic fatigue, but we're not there yet. There's still a significant number of Canadians that are, quite vulnerable to this. We know throughout the research that anyone that's medically vulnerable can, have a worse reaction to this virus. So we do need the community's help to continue to keep us safe and protected.
Yeah. Now, with conditions like this and so many illnesses, it could be like a full-time job, and that brings us to Chronically Simple. It's something you've developed, and it's seen some improvements since. This app helps us navigate all the medical needs in one spot, in one app. Tell us about it.
Yes, so Chronically Simple is a web-based and mobile app that I developed with my team shortly after I got diagnosed to help me keep track and manage all of the administrative burden that comes with living with a chronic illness or a disability. Of course, you can see our vaccination tracker, which is quite timely, the new feature that we released to help our population keep track of their vaccinations dates and status. We've got symptom trackers, appointments, medical. It's shareable so that, I have my whole care team on it. It's really just to help alleviate some of the burden that accompanies living with a chronic illness or a disability.
What's the security of this? Do you have to enter your health card number?
You don't have to enter anything. It is completely at the user's discretion, but I am I'm a patient myself. I have my personal health information in there. Data privacy and security is top of mind in everything that we do. So I would say we absolutely follow all of the privacy legislation surrounding personal health information to make sure that any information that our users do enter is kept encrypted and secure at all times.
Okay, and there's two versions. There's a free version, but there's some enhanced features as well.
Yes.
Unfortunately, we've run out of time, but you know what we'll do? We'll link up the website so people can explore that and find out which suits them best. Thanks for sharing your story and this technology, Kristy Dickinson.
Thank you for having me.
Chronically Simple.